So I created my mind map over the breast imaging, reporting, and data system, and there are 5 categories: tissue component, masses, calcifications, special cases, and associated features. The first one being tissue component. A mass can either be homogeneous or heterogeneous, and with homogeneous it can be fat or fibroglandular. And from my understanding, it's more common to see that dense fibroglandular tissue in younger women. And there I put 2 examples of fat and glandular tissue. Next, we have masses, and we basically describe the characteristics of the mass: its shape, its margin, echogenicity, posterior enhancement. For shape, is it oval, round, irregular? Margins, does it have smooth borders or defined borders or not? Echogenicity, is it hyper, hypo, iso? And posterior enhancement, does it have it, does it not, or does it create shadow? In this example, we see very hard shadowing posterior to the mass. And then for orientation, is the mass parallel to the skin or is it perpendicular to the skin? And there we have examples of its shape too. Next is calcifications. So we either describe calcifications as being inside the mass, outside the mass, or inside the ducts. Next, we have special cases. So this includes simple cyst, implants or foreign body, and lymph nodes. In my clinical site, we scan a lot of breast with women who have implants. So I think it's also important to know sonographically what those look like. And then we also have a lot of women who feel palpable masses on their breast, and it ends up being an enlarged lymph node. So here are some examples of these special cases. That very top one is an example of a simple cyst. It's anechoic, has smooth borders, it's round, it has posterior enhancement. So this would be given a BIRADS 2. And then right below it is an example of clustered microcysts, and this would also be given a BIRADS 2. However, once it kind of starts looking a little bit more solid or complicated, then it would be bumped up to like a BIRADS 3. And then those are examples of implants. The very top one would be a ruptured silicone implant, and it gives off a snowstorm appearance. And then right below it, I think this is an example of a saline implant, but I'm not too sure. But we could see like 2 echogenic parallel lines, right anterior, like right in like the anterior portion, indicating where that implant begins. And then I put an example of an enlarged lymph node. And next we go over associated features. So this includes vascularity, skin changes, duct changes, architectural distortion. So vascularity, obviously we're going to put color Doppler on the mass and see if it's vascular or not. With duct changes, it's usually with pregnant women, we kind of see those ducts more prominent in ultrasound. And then with architectural distortion, regarding the Cooper ligaments, masses can sometimes kind of tether those ligaments towards the mass, I guess, and I'll put an example on here too. And then here I just put some examples of some masses that have been biopsied, and that is all.